There you go, and then I just make them. Yes, I just click on, yeah, I do make it into a slideshow. Well, thanks for that introduction, Lindsay. I'm Sarah from the library service in Northumbria Healthcare up in the northeast of England. This presentation is about this poster that we presented at the HLG 75th anniversary conference last year, or earlier this year. It's on the topic of, can reading change the attitudes of foundation year 1 doctors towards dealing with deaf and elderly patients? That sounds like a pretty big question. Oh, and I think I'm on auto, but anyway, I'll keep clicking backwards. So I'm just going to give you some background to start with about how our library service came to ask that question in the first place. So Being Mortal by Atul Gawande is a fabulous book about, amongst other things, the way that current medical practice can limit options for frail, elderly or dying patients. But with a change of attitude among clinicians, care can better enhance and comfort our experience as we age and die, as we all will. It's an American book and it discusses US practice. So sometimes you kind of think that's not really relevant, but the points are also often very relevant to the UK and the NHS. So, inching forward in history, in 2018, our medical director launched a realistic medicine drive in the Trust. And as part of that, he wanted all of our staff to read Being Mortal because he'd read it and was totally inspired by it. So just to give you a summary if you haven't heard about it, but realistic medicine puts patients at the centre of decisions about their care. It encourages health and care workers to find out what matters most to the patient so that the care of their condition fits their specific needs and situation. It can be summed up in the phrase, it's not what's the matter with me, it's what matters to me. So the library supported the idea of getting all staff to read the book by buying multiple copies and setting up a monthly book club. And we had Being Mortal as the first book that we encouraged everybody to read. We advertised it widely and we had small group discussions about it on our hospital sites. And we also facilitated a discussion about it at one of the Trust's grand rounds, which all staff are encouraged to come along to each month. The impact it had on people who read it quickly became clear, and we summarised the progress so far made by the book club in a conference presentation at the Health Libraries North Conference, It's Great Up North, in 2019. So to maintain momentum about the project, in 2021, in August, we gave all of our new F1 doctors a copy of the book at their induction. Partly this was a welcome gift, and it was also to encourage them to read it. We've had giveaways such as pens and bags for these inductions for many years, but the doctors seemed really appreciative to receive their own copy of a book. In order to evaluate whether giving them that book had been effective, we sent a survey to all of the F1 doctors the following year in July to ask if reading Being Mortal had impacted on their attitudes and practice. And that survey and its results was the basis of our poster presentation. We only asked 4 questions in the survey to make it quick and easy to complete. And we included a draw for a book token for everyone who sent in a response to help encourage completion. We sent out 54 surveys. We only got 7 responses back, but even that small sample gave us some really rich and useful data. I'll describe some of the responses now to give you an idea of what the survey uncovered. 5 of the respondents had read the book, and even those who hadn't appreciated the welcome gift when they started working. Free text comments included these. So I was so glad I read this book. I found it so well written and insightful. I don't currently find the time or energy to read, but appreciate the sentiment. And this was a lovely book and one that I'd wanted to read for a long time. We asked if they discussed the book with any friends or colleagues, and some of them had discussed it in the context of work-based conversations about the end of life or palliative care patients. Some of those comments were, I bring up this book with colleagues when I'm caring for patients approaching the end of life, or we discussed it when making decisions regarding palliative care patients. And it had changed their opinions or attitudes, giving new perspectives on death and aging. So, for example, this book completely changed my perspective of this issue, and it's made me appreciate death in a new way rather than just being scared of it. So that comment in particular is such a powerful statement, isn't it? We also asked if it was worth us repeating the gift to the next new doctors, and for that we received comments such as, I remember thinking it was a nice gesture and it marked the start of a career. And it was a truly lovely start to the job and the most valuable thing I received starting. Based on the data from the survey, we've repeated the free gift offer for the past 2 years. Last year, we offered either Being Mortal or the Tools of the Trade poetry book, and there was a fairly even split between people who chose either of those. This year, we offered a selection of books, and only one person chose Being Mortal because the others said they had already read it during their medical degrees. It was so positive to hear that and to know that the message in the book is being so widely spread. I really hope that it's having the impacts demonstrated in our survey on everybody who reads it, and that's leading to more realistic medicine being practiced by clinicians whose attitudes have been changed by this powerful book. Thank you so much for listening to that. Have you got any questions or comments about that little presentation?
That's so brilliant, Sarah. It's so lovely to hear the impact. The fact that everybody came back and said they'd read it is excellent.
Yeah.
Someone's asked in the chat how much it cost.
Well, I think, what did we buy? There was 54 new doctors, so we bought 54 copies of it. We get the SIFT budget has agreed to fund it, so they just paid for it for us, the undergrad funding. So 50 copies of the book at however much it costs.
Okay, and Sarah has also asked that you mentioned taking it to Grand Round, but was there anywhere else you took the discussion with the books?
We had sort of the actual book club when we first started it with Being Mortal. We had like little book discussions in each of the libraries in the month. So we only had little small groups with that. The Grand Round was open to everybody. So again, we've got 4 hospitals in our trust. So at each of those 4 hospitals, there was like a discussion amongst people in the room and online. And one of the things we've always done is encourage people to fill in comments cards that we put in all of our book group books, and we put them on our webpage. So it's kind of not a live discussion, but we encourage them just to give us comments and say what they thought about it.
Alison, as I can see on the screen, do you want to come in with your questions?
I can indeed. I wasn't sure. I thought I'd be polite and put it in chat. I'm just really interested in your book club, Sarah, because it sounds fantastic, and whether it's still running, and whether it's in person or virtual, and whether how you sort of run that. Really, I think would be interesting.
So we're still buying a new book every month. So we have our book of the month,
Right.
and the first ones were all kind of clinical. So we had Being Mortal, then we had With the End in Mind, and I can't remember the other titles. What I'll do is I'll put a link on that's got all of our book club, the books we've had and the comments we've got about them. But we've spread into more kind of health and wellbeing ones as well as the clinical topics. And we've never managed to get in-person book groups going particularly well. There was a couple to start with, and then they kind of tailed off. But we just encourage comments and then try and share those on our website and Facebook.
I think that's lovely, because I think that's often the challenge, isn't it? We find, it's very difficult to find a time and a place that's convenient for everybody. But I love the idea of just that whole emphasis of people just reading together and sharing thoughts across the whole organisation. I think that's lovely. Yeah,
definitely. Yeah. There has been a medical student book group for a couple of years, and I think they've included that book each time as well, because it is such an important one for them to kind of discuss and consider ways of supporting aging and in much more positive ways.
Yeah, super.
We've got another practical question about running the book club. So do you buy books for everyone each time? And do they all get used up? How does it work?
Yeah, what we tend to do, again, because I said we've got 4 sites, is we buy 6 or 8, maybe 6 for each site. And then we just have them in the library on display, and people are welcome to pick those up. So it's quite relaxed. It's not the particular group, it's just anybody who wants to join in can do. And I think my colleague Jenny has just put in the chat that we're offering, so we have multiple copies of lots of the titles now, and if any other library services want to borrow those, we can certainly send you several copies of any of the titles that we've got in the region. Yeah.
Fantastic.
Brilliant, Sarah. Thank you.
Oh, thank you.
Are there any more questions for Sarah before we move on to our next presentation? Oh, and I think people can get in touch with you, Sarah, if anybody wants to ask you anything else. Okay, brilliant.
Yeah. Thank you.
Okay, shall we move on to Gavin? Oh, there you are. Seen you pop up.
Yes. Hello. Hello, everyone. So I'll just share my screen. This is what all goes horribly wrong. No, it worked. Excellent.
No, all good.
Yeah. So I'm Gavin Moore. I'm the Knowledge and Library Services Manager across 2 trusts. South Warwickshire and George Eliot Hospital NHS Trust in the Midlands. So today I'm going to be talking to you about searching for guidelines and patient information, and this is a bit of an update on a project that I started in a previous role at University Hospitals Coventry and Warwickshire, and has kind of continued in my kind of current role now. So I'll be giving you an update on what I did at UHCW and then what I've been doing since and where I think the project's going to be going. In terms of the programmable search as well, it is very much sort of a technical solution to a problem that arose, which I'll go more into in the next slide. And I'll be giving you a glimpse of kind of the back end of how to construct one yourself, and showing you some of the documentation that I've created alongside it, as well as where you can access my one, because it is now available on the internet where anyone can access it if they want to use it. So without further ado, is it going to work? This is where another thing can go horribly wrong. There we go. So background at University Hospitals Coventry and Warwickshire. So initially I started looking into this with the demise of nice evidence search, because at UHCW I was a CBIS specialist, and we used to do searches for updating patient information, updating guidelines, things like that. And we used to rely obviously quite a lot on nice evidence search to find existing guidelines and things of that ilk essentially. But obviously I think it was March in 2022, NICE stopped functioning and was no longer supported. So at that point we were looking around for a suitable replacement. It was suggested that we could use TRIP, but having looked at TRIP, it didn't really fulfill the same purpose. And Andy at UHCW there, the manager there, he talked to the person that one of the people involved with running TRIP, and they said it wasn't really a suitable kind of replacement really. So we were still kind of looking for something else we could use for the similar kind of purpose. So I Googled how to create a search engine, and it brought up this identification of a kind of service from Google called the programmable search service, or as another term for it, a custom search engine kind of service. There are others out there. I've focused on using Google. I'll mention why in a second. And there are other variations of them though that you can use. While I was at UHCW, I initially developed the search. So we did some initial kind of testing, pulling together a list of sources that the search would search. So that includes a list of websites essentially that this new programmable search would go to. So I created an initial list and ran some test searches on it. And if any of you saw that poster presentation that was sent around in the email from HLG, you might have looked at that, and there were some results there from some initial kind of questions that I threw into it. That did pull back some positive results, I would say. So it did look like it was a goer in terms of a project. So we developed it a bit more. And it was used in action, I would say, at UHCW, because we had a project ongoing at sort of the latter end of 2022, where we were sort of benchmarking all existing guidelines against nationally produced ones or internationally produced guidelines. And as the CBIS team, we used the programmable search engine to get through that workload quicker. Because one of the things I would say, the benefit of creating something like this is it's I know you obviously can search on Google or another search engine, but the programmable search limits you to certain websites that you put into it essentially. So it's a more focused search essentially. And I'll show you how that works when I do the demo. So we have used this in earnest at UHCW, and it worked very well, I would say. And I got some good feedback from the CBIS team there. Since I'll just kind of give you up on screen now a quick description of what a programmable search is, and this is what Google calls a programmable search. So it lets you include a search engine on your website to help your visitors find information they're looking for. Essentially, it's a search engine that you can construct and embed on your website. Mostly these search engines are being used for commercial companies to search their own websites. So it's how you would have a search feature on your own website. But I did look for the other quote that they had previously on their help guidance with Google, which is where they talked about it being more like being able to create your own subject search as well, because they were advertising that. I wasn't able to find that this time around, so I don't know if they've changed their help. Because one of the benefits of using Google, I would say, and why I've used Google programmable search engine for this, is that it's got a familiar feel when people actually see the results, so they know what they're getting and they know how to filter it and refine it. It does look familiar, but the negative side of using these sorts of things does come with the fact that Google does control it, so things can change. They've definitely changed the interface since I started doing it at UHCW. The interface to setting one up was completely different now, and yeah, I'm assuming that quote that I found previously has now disappeared. But yeah, these search engines are essentially a search engine that you can set up yourself. So what currently the development I've undertaken at Swift and George Eliot. So we've created a new interface because we've had the new Google interface where I've had to adapt and recreate what I did previously. I've developed an expanded and refined list of sources, so websites. I've changed, the original search was one that searched for patient information and guidelines in one. I've changed that to searching them separately now, because that allows us to be a bit more targeted in our results and do things slightly differently. And then I've also been in contact and demonstrated this to the LSTF, which is a group down in London. Adam, who will be talking after me, is obviously one of the leaders of that group. And having talked to them, they're very interested in setting up a group where we would share the responsibility for updating the list of websites and checking the list of websites. So it might be a group project ongoing in the future. And I've also shared the search on the Swift and GH website as it currently stands, the one that I've created, that you would be able to have a look at. So now I'm going to quickly jump into a demonstration. So if I'm going to come out of my slides. So bring this up. So initially I thought I'd show you the programmable search and where to access it in case you wanted to set one up yourself. So you can just Google programmable search, and when you click on here, it will bring up the login for you to get started at the top here. You will just need a Gmail account essentially, or a Google account to be able to get started. Once you log in, you'll go through to a similar-ish page to this, or what they call the what do they call it now? It's gone straight out of my head. I did have the term in my head and it's gone straight out. But this is the center essentially where you can create your search and edit it. And you can create multiple searches. So you can see here I've got a guidelines and a patient information. I am considering setting up a policy one. You can click add to create a new one, and it'll just add one in there. You'll have to give it a name initially before it gets added to the list. One thing I will say, with Google setting this up, I will point out they have got a really nice help center. So when you're setting this up, you can ask questions here, or go through kind of what is a programmable search, how to create it. The instructions they have in here are really straightforward. I mean, I have not a great deal of technical expertise, so they helped me create one and to be something that's reasonably workable. So I would say that their help guides are really reasonably quite good. But to show you what one would look like once you go into it, so if I go on the guideline search, you can see down the left hand side you have all the tabs that you can go through for altering how the search looks and things like that. The main thing that the sections you'll be going through, I would say, is the overview. For this is the features, how it looks. I say search features, look and feel. I've never really gone into statistics, and you don't have to obviously select things or use all the different options that they give you. Some of them are very technical and I avoid, and just get something that works essentially. So I've got the name for obviously at the top, that's your basic information there. You've got the public URL here, which is what you would use to embed in your website. Search settings I've just left off for image search, save search, and search the entire web, because we want it to search websites that we want it to search. But I have let it search all regions. And you have here, look, sites to search. So you can add in a list of sites that you want the search engine to search. And you just click on add, and then you can add them in either as a list, if you create a list separately and add them in, or you can add them in singularly. Obviously, I've added 307 here for the guideline search. So this search engine will now search these websites and these websites only. You can tell it to exclude websites if you wanted to. I've just gone for tell it to search the ones that I want it to. I haven't really altered many of these themes for look and feel. Members is who can alter it and set it up, so I've left that as is. The other main feature that you would probably want to look at altering is the search features. So if you go on the left hand side to search features, you can add in some refinements, and refinements essentially are little tabs you would get on Google. So I've done these based on kind of like the different types of websites that I'm getting it to search, and also the different types of content. So you can see you can click add to add a refinement, but if you click into one of them, I can show you what one looks like. So you can tell it to search within the site in this refinement. So this one's obviously just got the list of NHS trusts in there, or should have. It seems like it's changed. I might have to delete them out and update that, but it should just have a list of the sites that you want to for it to search specifically in there. Although it might just be it clicks them. Let me see. Things do change every so often with these sites. I think you tick it. This shows all the websites that are available that you've added on the previous page, and then you tick the ones that you want it to search essentially. The other thing that you can add in is you can add extra bits to the query when people click on that tab. So for instance, in the PDFs, I've told it to add in the file type the PDF file type as a search edition there. The other thing that I've done in the search features, and this is, I would say, essential if you're wanting to search for certain types of content, is just have a general query edition. So when anyone types anything in, so say like asthma, it will add certain keywords on after it. So it will be asthma and guideline or position statement, etc. And that will narrow it down to the type of content that you want. And that's a quick overview of the back end of it. There's a lot more very technical things you can do with it as well. But I'm not going to go into those because I'll confuse myself. But the other thing that I thought might be useful for you to see in terms of creating something like this is creating a list of websites. And I've done this in Excel. So you can see I've got all the NHS trusts, a list of charities, lists of regulators, professional bodies. I'm mostly focusing on UK. What I've done is list the name, then list the website, where I've got the website from, and then also put it in as a domain. So domain is the widest possible way to add a website to the search engine. Essentially, you've got the little asterisks at the beginning and the end, so it does anything before and anything after. But you could search a web page, a website, or a domain. You can tell the search to do what you want it to do. So it could be more specific than this. But this is the type of document that you would need to create in terms of for your sources. But to show you how to access the current search and then to show you what kind of the final product looks like, I'm just going to say, I mean, you'll probably find it quite easy to find our website, but if you Google Swift Library, it should come up probably second result, or it should be in the health libraries. What is it, the HLISD in there as well. But if you just Google Swift Library, it should come up. If you're on our library website, if you go to information resources, we have got the two searches that I've created here, so one guideline and one patient information. So if I show you, say, the guideline search, we can search a topic in there, asthma, and unfortunately Google, so you have adverts, but you can see we've got the tabs at the top. We've got the way you can sort by relevance or date, but if you scroll down, you do then get the results. So this is searching everything, so all the websites that we've got. So you can see you do get some odd sites come in because I've told it to search PubMed as well, although it is narrowing down to guideline and things. But you can see it's pulling things from NICE. We've got things there from an acute asthma management guidelines for infants, from Sheffield Children's, and this is just a general list of results. If you go to NHS Trust, and we were to scroll down, you've got the more trust guidelines. So that's from Gloucestershire. We've got where's another one? We've got one there from Hayon. I'm going to presume that's Hayon Y or something like that. And then we've got Leeds as well. But you could also go to, say, like professional bodies, look for PDFs, regulators, or databases like PubMed if you're looking for British guideline on the management of asthma, things like that. The reason I added the databases in was for that kind of content that wouldn't necessarily appear in, because it was a published article, so it wouldn't necessarily appear in the other places. Quickly to show you how it's different on the patient information side of things. So if we can do asthma again, exact same search. If I scroll down, you can see we've got inpatient information now from different places, asthma and lung, how they produce it, as well as on that page, I believe they've got links to their information as well. A patient's guide from Whittington NHS Trust, I'm going to assume that is. But up here we've got NHS Trust, but we've also got charities which we didn't have on guidelines. So you could get some of the information directly from the charities as well. And it's just I think from experience of doing searches for this type of content in CBIS, this just speeds things up a bit. Compared to just searching Google and having to put in all the site endings and things like that. But I will, if I jump back to my slides, I think I'm on my last slide now, which is, I think, any questions?
Thanks, Gavin. I've never seen that before, so I am definitely going to go off and nerd out on that this afternoon. So thank you.
Yeah, it's I think they've been widely available, custom search engines and programmable search engines. I'd not heard of them until the need for one come up, but I think they must have been going for ages, to be honest, because I have seen the embedded searches in websites previously. But yeah, is there any
I have a question from Alison for you. Actually, Alison, you're on screen. Do you want to come in
I'm going to go say again. Yeah, sorry. Sort of chair's privileges, isn't it? Absolutely brilliant, Gavin. I love the idea of it streamlining, and I can see how much time it would save. I'm just curious as to how long it might have taken you to identify and test that first iteration list of preferred websites, because it seems like a big task to identify all of those domains.
Yes and no, because the first iteration when we were at UH, so at Coventry, when we were looking at it, came from, luckily, we were looking at it prior to NICE disappearing, so I was able to download the NICE lists essentially. But having looked at the NICE lists, the content was a bit all over the place in terms of where they searched. So it was difficult to figure out the rhyme or reason why certain places were being searched and others weren't. So we did decide to start from scratch. So once we decided that, it was a bit more straightforward, because things like the NHS trusts is obviously a directory list of those, so we could pull that off the NHS site itself. The professional bodies are difficult. I'm going to say that they're difficult to locate, but I went through the regulators, so the regulators are easy to identify, and then to find the professional bodies, you go via the regulators, and there is some what are they, like groups for, say, like the Royal Colleges and things like that, so you can pull the list from there. So where I had in that Excel spreadsheet where I'd sourced the location from adding the website, that was some of these like groups that I'd gone to find the place where I'd identified the body. Charities were quite, again, and they're another difficult one because there's thousands. I had initially considered going to the government list of charities and going through it, but again, that's not comprehensive, and there's loads of them on there. So I went to the PIF-TIC website initially and got them from there. And that's expanding as time goes on with the PIF-TIC. But obviously, if they've got the PIF-TIC, they're producing potentially patient information, so they're a good list to grab them from. But it definitely does take time, and then putting them into the Excel spreadsheet and then converting them to domains and things like that. Yeah, unless you're a bit of a whiz with Excel or Word and can delete parts of the websites out and re-add them back in. It can, if you're doing it manually, it take a lot longer. But if you can figure out how to delete parts of the web addresses, URLs quickly, you can come to it quite quickly, I would say. I think the ongoing problem is going to be keeping it up to date, and then obviously adding more content, because this is an initial list. So hopefully we'll be able to add more sites and make it a bit more comprehensive as time goes on.
Super. Thanks, Gavin. Really interesting. Thank you.
That's okay.
Do we have any other questions for Gavin?
I thought I was Adam going to ask one then.
Okay, well, again, if anybody does have questions, I'm sure they can get in touch with Gavin outside of the session. So, Adam, I can see you've popped up. Shall we move on to Adam and Lucy and hear about the sustainability group?
Thanks, Lindsay. Hi, everyone. Can you hear me okay?
Oh, you're quite quiet.
Okay, sorry, bear with me. Can you hear me better now? I'm sorry, this rigmarole keeps on happening. Bear with me 1 second. I thought I had it sussed. Apologies. I'm just some setting adjustment on the. Okay. Okay, is that any better now?
Still quite quiet, I'm afraid.
Okay, bear with me a sec. Okay, that any better? No? Sorry, bear with me. Apologies, everyone. Okay, how about now? Any good?
A little bit better, but you are quite quiet. Maybe we'll just all be very quiet.
Bear with me 1 second. Is that any better like that? No? Oh, I'm sorry, I don't understand what I've done wrong here. I've literally been on a Teams meeting this morning with it all. Don't understand what I don't think I can adjust my audio anymore, sorry. Oh, hello, is that better?
That is better. I don't know what you did, but that's a bit better.
Right, I am not going to move out of this position then. Okay, so everyone, thank you for your patience there. I'm going to try and share my screen. I hope that goes a bit better. Let's see. That's, yeah, screen getting shared. So you should all now be looking at my team screen. Is that the case? If someone could audibly confirm.
It's a blank screen, Adam. Is that what you meant to see? Oh, there we go.
There
That's
it is.
you.
Okay, right. Now you should be looking after that wait. So yeah, thank you for having us, everyone. Thank you for putting up with my audio situation. So I'm joined by Lucy Gillam of Hampshire Healthcare to talk today about the sustainability in NHS knowledge and the library services community of practice. We're the co-chairs of this group, so we're going to take you on a tour of our future NHS workspace, tell you about the group. But first, before Lucy does that, I'm going to kind of contextualise things a little bit. And I'm sorry to get a bit heavy with everyone around lunchtime, but look at this. Oh, so what you're looking at here are the wildfires in Australia in 2020 that approached Canberra in this particular picture. However, I could have instead used a picture of New York from last week, from Spain the previous week, maybe even that biogas container explosion from Oxford last night, which is being attributed to a lightning strike. Lightning strikes, of course, now being a more regular occurrence owing to a warmer atmosphere, creating more humidity in the atmosphere and more electrical charges. That's one thing we're going to have to do with deal with going ahead. What I'm trying to do here, rather than panic everyone or make you feel all sad, is just stress the importance of this work and the urgency of the situation as well. So, more with a more narrow focus, then, why sustainability is important for the NHS. There's a few reasons. So the change in climate is affecting the population health. So the people that are treated by the NHS are being made unwell by the effects of climate change. So here's a picture of Kissy Deborah, whose death was attributed to air pollution. In the middle there, we've got a slide picture showing there's an increasing demand for heatwave advice because obviously planet's heating. Our summers are getting intolerably warm. It's affecting our populations, but it's also affecting the NHS operationally. So while I was working at Barts Health, we had our emergency department flooded out at Whipps Cross, that's pictured on the right there. And unfortunately as well, even as the NHS is trying to treat people, it's actually contributing to the problem as one of the biggest employers in the world, and such a huge operation, it's going to be pumping out some emissions. So all this is happening and has been steadily increasing. Newcastle upon Tyne hospitals, and if there's anyone representing that trust on the call today, good on you. Their trust were the very first to declare a climate emergency amidst this backdrop. They subsequently joined by other trusts, including Great Ormond Street, but they were the first to recognise how existential a threat this is and respond accordingly. Right? So the year after they did that, Dr. Nick Watts and his crew somehow, in the midst of COVID, were able to publish the Delivering a Net Zero National Health Service report, which outlined plans to make the NHS the world's first net zero national health service. And yeah, quite how they did that while the world was gripped by the pandemic is nothing short of miraculously prescient. So good on them. In response to this, Knowledge for Healthcare, the strategy that underlines the direction of all the library services within the NHS, they made sustainability a guiding principle of the 2021 revision of Knowledge for Healthcare. So it's mentioned throughout, though there's not as much concrete practical examples as you might hope for. And we're hoping we can change that with the revision that comes up. That's the name of Lucy and myself and our group, more on that. The following year, though, crucially, the Health and Care Act made the recommendations from the reports delivering a net zero NHS health service legislation, right? So we're now the first and only, I think, state health body that has a legislative commitment towards working to net zero. You can argue that it's not enough, that target, but we are where we are, getting to net zero by 2050. So with that passed into legislation, the Greener NHS programme got up and running, and there are e-learning modules on e-learning for healthcare produced by Greener NHS. If you're after a what's the word, a grounder and explainer on net zero and net zero within the NHS in particular, if you go to e-learning for healthcare, look for Greener NHS, you'll get their modules. A useful primer is the word I was trying to think of. There you go. Okay, so following this, every NHS trust is now has now got a green plan. Here's Leeds Teaching Hospitals. But beyond that, just about every department within a trust or within the NHS, every specialty, every group of professionals, paraprofessionals, is doing something to help the NHS and their trusts in particular meet their sustainability goals, help the trusts achieve their green plans. Right? And libraries are no different. So I will hand over to my colleague and co-chair Lucy Gillam to tell you exactly what we're doing to help libraries and librarians within the NHS help meet sustainability goals and their trust green plans. Lucy, it's over to you.
Thanks, Adam. Are you going to still do the slides?
Yeah, I'll drive.
Okie doke, thank you. Hi, everyone. Nice to be here and see you all, but not really, only virtually. And Adam, I just have to say that you've let me down and have not worn anything green. Green Libraries Week. I think I can see Alison in a green cardigan. Yes, I've got my green t-shirt on. Anyway,
I can only apologise, Lucy.
I'll talk to you later. Yep. So, if anyone else is wearing anything green today in support of Green Libraries Week, please put in the chat. So I'm just going to introduce how the group started, how the community of practice started. So back in November 21, Richard Bridgen asked the Library and Knowledge Services staff for recommendations of sustainability ebooks for national purchase. That's kind of the grain of where it all started. So, and this resulted in a collection of 27 ebooks that can be found on the internet, and we've got the website of a direct link to that is on our last slide. So don't, or Adam, post it if you can, but we will catch up with that at the end. And so at that time, Richard also mentioned that there would be an LKS sustainability COP being launched in early 2022. So February 2022, it was launched. There was an event on the 2nd of February, and there was an aim of setting the group's objectives and purpose. And so the terms of reference were started, and obviously you can see those on our Future NHS site, which we'll have a quick whiz round in a moment. But the terms of reference were created stating that there'd be meetings and a Future NHS workspace. So our hub address is on the current slide there. If you want to join, if you're an NHS, have an NHS email address, it's quite straightforward. You can log in and join the group. If you're non-NHS, if there is anyone out there that doesn't have an NHS email address, the easiest thing is to directly email myself or Adam, and we will sort that out for you. So we do have non-NHS members, even at least 2 of those are from outside the UK. So we are literally an international group. So it was not until a year later that Adam and I took over the chairing from Richard. And that's what we volunteered, and that's what we've done. There are quarterly 2-hour meetings online. Everyone welcome. The next one is on the 8th of November, so if you've not signed up, please do if you're interested. We do have 123 members, as I checked yesterday, so it's increased even this week, which is amazing. So what's been shared, discussed already? So our success stories. One of our members, Sam Stormont, from West Hertfordshire Teaching Hospitals, has put together a matrix of suppliers looking at their sustainability credentials, and again that is on the site. I produce a sustainability healthcare bulletin. We have members working with their trust's sustainability teams and our QI teams, introducing SUSQI from the Centre for Sustainable Healthcare. We also have people who work with special interest groups like Green at Barts Health. Some of us from the COP attended the first ever Green Libraries Conference in March, and we have had a speaker from the Green Libraries Partnership talk to us at one of our meetings. I think that was in our May meeting. And this meeting that we just had in October, we had Peter May, who is the Net Zero Policy and Delivery Manager at Greener NHS. So his slides and Blurina's are on our sustainability Future NHS page. So if you could open up the, Adam, if you could open up the actual website and just show if that's possible, if we have time.
Right. Oh, I should have had it running before. Log into it. I thought I was there, and I was not. Here we go.
Okay. Thanks, Adam. So it's opened up on sustainability discussions, which, as you can see, we've had a few things going on. I think we have more in the slides there, but obviously, if you click on the join the conversation, you can make the group aware of events going on, ask questions. We also have a document library, which is our most extensively populated one. So you can there see that we have Peter May's slides. We have the sustainability and healthcare bulletins. We also have a small bank of shared searches and summaries. Would you mind clicking on the shared summaries, Adam?
Yeah. Sorry, the view's not the best, is it? Let me try to change that. I can't figure out how to do that, Lucy.
I can't remember off the top of my head. So if you just look down the menu on the left-hand side, you can just see some examples of searches that have been posted up there. So one on the climate change NHS adaptation strategy, one on patient plate waste, and that one was done for my food sustainability group in my trust. So you are very welcome, if you have any of your own sustainability related searches, to post up your search results on there. That would be, the bigger it is, the more we have to share, the better. So are you able to go to the calendar, Adam, please? So we've got a calendar of events. Obviously, it's Green Libraries Week this week. And we also have the Net Zero, I think that's later on. That's next Tuesday, isn't it? The Net Zero Clinical Care Conference. As I said earlier, our next meeting is on the 8th of November at 11 AM. And I think that's pretty much it, Adam, for the site. Are you able to go? Well, unless you can think of if there's anything else you want to point out, but
I think that's it covered there, Lucy. We've got the discussion forum. Oh, here's how it looks when it's busier, the discussion forum. Sorry, that's when you open any one post that people have posted, you'll see the responses. So yeah, that gives you a better idea of that. You know how future NHS is. Sit there.
Yeah, thank you. So there's a thread there on calculating your own library's carbon footprint, which was something that they talked about at the Green Libraries Conference. And all the slides from there are on our future NHS site. Next slide, please, Adam. So that was from when Peter May was talking. Peter May featured bottom right, Adam to his left. And that was in September 2003. So he just talked about the journey to where we are now, or where the NHS is now, from obviously the point of view of greener NHS, and to sort of look at what they were focusing on next. But yeah, have a look at the slides if you're interested. Next slide, please, Adam. So a quick advert for myself, shameless. The healthcare bulletin that I produce, I post on the future NHS site. You can also subscribe, so if you want to email me directly to do that, you can. There is also now an editable version. So obviously the idea behind the database is that it's showing research and the latest information on sustainable healthcare, looking at treatments and how populations are being affected by climate change. So, and I use several different sources, including our 3 main databases, to compile that, and as well as using the Greener NHS Bulletin for case studies and CPD events. Again, the URL is going to be on our final slide. So I am happy for you to tailor that bulletin and send it out to your trusts. So what's next? So very, very quick. So next meeting in November, we have a guest speaker from the National Institute for Healthcare Research on decarbonising healthcare. We are looking at doing more collaboration with the Green Libraries Partnership, and we currently interact on their Green Libraries Network, which is called Basecamp. We want to make sustainability more prominent in the next Knowledge for Healthcare, and hope to create a Green NHS LKS manifesto. There is also someone called Rebecca Smith Aldrich, who we would like to get to talk at our meetings. Her Sustainable Libraries initiative in the US seems to be streets ahead of us. We recommend her webinars. which again we will. I think that website is on this site, but we can send that. That will go out with the slides anyway. So that is us in a nutshell. Do we have any time for questions? 1 minute. We can look at the last slide, Adam, and that's got all the website addresses on. Okay, so that is it.
That is brilliant. Thank you, Lucy and Adam. It is dead on 1:30, but does anybody have any burning questions for Adam and Lucy while we have them? In which case, I hand over to you, Alison, just to finish off.
Super. Thanks, Lindsay. I will keep it really short and sweet because you'll hear more from us, I think, about this topic in the coming months. Huge thanks to all our speakers, particularly, I think, to Lucy and Adam for getting us to link into Green Libraries Week. And I think there's a real call there for us all to go and join the community of practice and find out more and get involved. It sounds like really it's timely. It's really important work. So thank you for that and raising our awareness of that and all the different resources as well. But also huge thanks to Sarah and Gavin, who also really interesting work that's going on. And I love the connections. I love the way that the work continues and it's spreading, and it's like all about collaboration, which is so important. Very, very quickly, just before you go, you will remember A Million Decisions. We've headed this as A Million Decisions and HLG. It's a combined initiative with CILIP, NHS England, Health Education England, as it was when it first started, and the Health Libraries Group, which is all about really having a really clear sort of campaign, a real clear message to get behind for all health and care libraries. That really ties in with the Health and Care Act about the use of evidence from research, about the fact that in the health service, 1 million patients are interacted with every 17 hours, and over 1 million decisions are made every day. And really, if they're going to be good and lead to really good healthcare outcomes, we want those decisions to be truly evidence-based, to draw on the expertise of all of you as knowledge and library specialists, health librarians, to actually underpin those decisions. So we are going to be sort of raising the profile of 1 million decisions a little bit more over the coming months and through next year. We are going to be having a common column in the Health Libraries Group newsletter, and we would love to hear more from the wonderful work that you're doing. Like we've heard today, all the things that we've heard today, you're probably all doing similar things in your own services, and I think it's great if we can share those, and if we can do it under the umbrella of Health Libraries Group and 1 Million Decisions, it helps to get that message out more widely. So we will be sharing more resources, there will be more information coming out, but that's all I'm going to say because I know we're at time, so more information in due course. Does that cover what we needed, Lindsay? Brilliant. Okay.
Yeah, I think so.
I think it just leaves me to say a final thank you to Lindsay, thank you to Health Libraries Group, and huge thank you to all our speakers and everyone for coming along today. Look at the slides, come back, ask questions, think about what you might want to contribute next time. We'll want to run more of these. Okay. Have a super rest of the week, everybody. Thank you.
Thanks, everyone.
Thank you.
Cheers both. Bye now.
Thanks. Bye-bye.
Thanks, Adam.